Hey, in this video, we're going to talk about how to get out of a mental hospital. So maybe you are an inpatient somewhere, you're sick of being there, you want to leave, you want to get out, but you're trapped, you're there involuntarily, or maybe you are awaiting to be placed on a 72-hour hold, or maybe you're in the hospital right now waiting to be transferred to a psychiatric facility. This is the video for you. This is how to act, how to behave, what to do to get out of a mental hospital. And if you are a loved one and you have someone in a hospital, but maybe they're too psychotic to even advocate for themselves or to follow these tips, make sure to watch this video here because there's a lot of tips in that video as to how you can advocate for somebody while they're in a mental institution. So without further ado, let's talk about what you should do while you're in a mental hospital to help get you out sooner. First and foremost, you just have to play their game. And as much as I hate to say it, and look, I'm a psychiatric nurse, I've worked in a number of mental institutions, and I can tell you this much about staff. A lot of staff that work in these institutions are egotistical. And what is an egotist like? They like it if you stroke their ego. So just think back to grade school when you had that teacher that was on a power trip. A lot of people who work in psych, not everyone, there's some wonderful psychiatrists out there, wonderful nurse practitioners, amazing psychologists, etc. But there's also a large percentage of people that just want to have their ass kissed. So when you're inside of the hospital, that is what you're going to do. You're going to play their game, which means you're going to take your meds on time. You're going to be med compliant. You're going to wake up on time. You're going to attend groups. You're going to be participatory in groups. You're going to act as if your life has changed for the better while you're in the mental institution. Everything you do while you're in that institution should be to get you out of that institution. So if you're arguing with staff, if you are on involuntary medications and every time you take your medication, you're griping about the fact that you have to take it, or you're saying, I don't want to take this medication, staff there, it's kind of like the Salem witch trials. The fact that you're bitching about your medication is more reason for them to keep you there. I know it doesn't make sense. It doesn't make sense to me. I completely disagree with it. However, this is what you've got to do to leave sooner. You got to play their game. And if you're on involuntary medications and you don't want to take the medications, that's fine. It's fine to voice your opinion in a way you would say something like, look, I understand I have to take this medication. I just want to say I would prefer if I didn't have to take it and I don't want to take it, I'm still going to take it. And then that's it. It's on the record, but you don't have to bitch about it every time you take the medication. It's not going to help you get out of the institution any quicker. The mantra you need to have while you're trapped inside of this facility is this: is what I'm doing right now, is this conversation I'm having with a peer or with staff, is the way that I'm behaving, is what I'm saying in groups, is this helping me discharge? If it's not, if you don't think it's helping you whatsoever, then don't do it. You want to be that exemplary patient. You want to be that patient that staff loves to have on the unit. You want to be that patient who isn't writing grievances, you're writing compliments. You're finding out maybe who the director of the unit is, and you're thanking them for hiring such wonderful staff. You want to be that patient who, even though you might not believe the medication is helping you whatsoever, and maybe the medication isn't, maybe the medication's making you worse, but you know what? Bitching about it's not going to do anything. So what I want you to do is say, God, thank God I'm on this medication. I'm starting to feel a little better. And you don't want to make it obvious. I'm not saying you go around and just blatantly kiss people's ass, but you want to make staff feel as though they are benefiting you, that the interventions they're providing you, the groups, the counseling, the medications, the therapy, whatever, is somehow having a positive aspect on your life. So for instance, let's say that you have a poor rap with staff right now. You're not getting along with staff. You've had a bad stay there. You can start to say things like, you know what? I know the first few weeks, first few months here has been kind of difficult for me, the first few days, and I've acted sort of inappropriately, but I'm starting to feel a change. I'm noticing I'm starting to feel better about myself and about where I'm at. Something like that. Something that allows staff to think that you are improving while you are there. And I want to mention this for all you oppositional people out there. I am the same way. I promise you, I'm very oppositional. I'm very like Mr. Au contraire. I want to question things. I want to be a skeptic and all of that, but inside of a mental institution, that kind of behavior, anything that could be perceived or anything that could be interpreted as oppositional, leave that aside. You can worry about, if you've got a beef with the institution where you're at, you can hire an attorney afterwards. You can get your medical records. And once you're free, then that's when you can bring out the big guns. But while you're in the mental hospital, you are there and you are under their care, and there's nothing you can do about it. So set aside your opposition, and the mantra, remember the mantra is this, is what I'm doing now in this moment helping me to get out of the institution? If the answer is no, stop doing it.